we're going to jump into an introduction into medical terminology. So because it's going to be based mainly on Greek and Latin words, med term is going to be consistent and uniform throughout the world. It's also efficient, although some words are going to be long, and they can often reduce an entire phrase into a single word. So if you look at that very last word that's down there, gastroduodenoscopy, then that basically just means that there is a communication between the stomach and the duodenum. So that duodenum is going to be that upper portion of the small intestine. And then your gastro is going to be in your stomach. So medical vocabulary is going to be vast. So it's going to seem like we're learning a new language. And honestly, it's because we are, right? So if you think of the terms that have been added to our vocabulary in relationship to some computers, we have software, search engines, flash drives, applications, things along those lines. But the test may seem overwhelming, but we're going to have methods that will help us learn and remember those words, and then even sometimes help us make informed guesses about any words that we're not super familiar with. Most words are going to be able to be divided into components. So we have roots, prefixes, and suffixes. These will help maintain the same meaning wherever they will appear. So it will help you be able to decipher and break down those words easier. So by learning these meanings, you can analyze and hopefully remember many words. The root, that's going to be the fundamental unit of each of our medical words. It's going to establish the meaning of the word as well as the part to which the modifying word parts are going to be added. Your suffix, that's going to be a short part of a word or a series of word parts that are going to be added to the end of the root, so to the last part of it, and that's going to help modify its meaning. You'll see them as the suffix with a dash before them. So here you'll see itis, and that has the dash in front of it. Your prefix, that's going to be a short word part that is going to be added before a root to help modify its meaning. So you'll see them with a dash after the word, such as hyper, and it has the dash after hyper. So whenever we see that hypergastritis, then that just means that it is inflammation of the stomach, basically over inflammation. Now, the prefix, again, that's going to be a short word part that's added before a word or a word root that helps modify its meaning. Most of our prefixes that we will discuss during the course will be in this chapter. It doesn't mean that we won't see any new prefixes, but majority of them we will go over with this chapter. Almost all of these prefixes will resurface at some point within the course. So if you are the flashcard type of person to help learn that material, then flashcards are really, really good to help you kind of ingrain those word parts into your brain. So you have different prefixes for, say, like your numbers. Here you'll see that, like, let's take a look at the word primary. We know that this word means first, right? Because that's just kind of like we're always used to, like, primary school or like a primary diagnosis or something along those lines. We know that that means that it's going to come first. But why does this word mean primary? So we haven't learned suffixes yet, but that ARY, that's going to be a suffix that basically means pertaining to. And so our prefix is that PRIM, and then that's going to mean that it goes first. So something that is primary is going to go first. It's pertaining to being in first place. Another one that we probably know is going to be quadruplet, right? So we know that quad means 4, but we also have a prefix that is the quadra, QUADRI, and that's going to mean 4. Poly is going to mean many. So if it's polymorphous, then that just means that something can have many different forms. Do those kind of make sense to everybody as far as those prefixes and for the numbers at least?
Yes.
Okay. All right, so we've got some prefixes for colors. Again, some of these will look very familiar to you guys. These probably, all of these won't be new. Cyanosis, so that just means the bluest discoloration of the skin due to the lack of oxygen. Some of these definitions are going to read a little bit what the true definition of a prefix, a word root, and a suffix will consist of. But we just know that cyanosis is that bluish discoloration. And then that of the skin due to the lack of oxygen is kind of a little bit of just an added verbiage to that definition. But cyano means blue, erythro means red, leuco is white, melano is black, and then xantho is probably one that you guys haven't seen yet. This one, I think this is the one that a lot of people say the first four look pretty familiar. But it's that xantho, which is yellow, is that one color that a lot of people say, well, I don't know. I don't know if I've seen that before. We have some prefixes that are also have like a negative connotation to them. So a or an is just going to mean that it is without. There's a lack of, there's an absence of something. So if something is anhydrous, then it just means that it is lacking water. Anti, I think everybody knows that that just means against. Contra, so if you have like contraindicated, then that's going to just mean that it is against the recommendation. D and death. So D is going to be for down, without removal or loss. Dis is going to be an absence, removal, or separation. So a dissection, or to dissect something is going to be to separate tissues for anatomic study. Your in or m, so the in or the im, non and un are all going to mean not. They can all be used differently, but they all just mean, so incontinent means not able to contain or control the discharge of your excretions. Non-contributory is meaning that it's non-significant. And then uncoordinated just means that it's not working together. And then some more prefixes. Like I said, we're going to see a lot of them tonight, but there really isn't going to be very many new ones that are going to surface after tonight as far as the form of prefixes. So ab and ad, those are similar in appearance, but they mean opposite. So ab is going to mean away from, and ad is going to mean towards or near. So we will talk about directional terms here in a little bit when we shift back over into our anatomy portion. But to abduct something, then that means to move it away from the midline. So if we abduct our arm, then that means that we're going to raise it up because we're moving it away from that midline. If we adduct, and so if we have our arm already like raised and we adduct, then that's going to mean that we are going to put it down or move it back towards the midline. And then again, these last three, dia, per, and trans, all mean through. So diarrhea just means there's a frequent discharge of fluid, fecal matter. So it just goes through. It doesn't actually stay in the system as long as it should for our body to absorb all the nutrients. Percutaneous is going to mean through the skin. And then transected is going to mean that it's cut through or across. Prefixes for degree. So meaning kind of like numbers, like to a degree of something, or it could even mean in like literal degree, like temperature. So hyper is going to be in excess, abnormally high, something that is increased. So hyperthermia is going to be high in body temperature. Hypo is going to be the opposite. So under, below, abnormally low, or a decrease. So if you have hypothermia, that's going to be a lower body temperature. And then a hyposecretion is going to be an underproduction of a certain substance. Oligo, that's going to mean few or scanty. So oligospermia, then that means that there's an abnormally low number of those sperm cells. The word pan, I think unfortunately we are all familiar with the word pandemic at this point. It just means that it is a disease affecting an entire population. And then super means it's above or in excess. So supernumerary, then that just means that it is in excess in number. We'll go over some prefixes for size and comparison. I'm not going to go over all of these because you guys can read them. We'll just kind of touch on some of the most common or ones that you'll see more often. You'll see that hetero is going to be heterogeneous, meaning that it's composed of different materials, because hetero means different, unequal, or other. Iso is going to be something that is equal or the same. So isocellular is going to have similar or same cells. Macro just means that it's not large or abnormally large. So macroscopic means that it's large enough to be seen without a microscope. We don't need that that zoom in capability to be able to see it. Neo means new. So if we have a neonate, when we see that term, then we know that they're referring to a newborn. So a neonatologist is going to be one that studies neonate or newborn. Ortho just means straight, correct, upright. So if you have orthodontic, then that's going to be a branch of dentistry that's concerned with correction and straightening of the teeth. Pseudo is going to mean false. So if you have pseudoplegia, then plegia, when we get into those suffixes, then plegia just means paralysis. So pseudoplegia means that there's a false paralysis. It just mimics that paralysis. And then re just means again or back. So if you have a reflux or that acid reflux, that's going to be a backward flow of that acid, that stomach acid. Prefixes for time or position. So you've got ante is going to be before. So antenatal period, that's going to be that period before birth. Pre is going to be before again, or it could also mean in front of. So something that is premature is just occurring before the proper time. Pro is going to mean before, in front of as well. So prodrome is going to be a symptom that precedes a disease. And then post is going to be your after or behind. So something that is post nasal. So if we have that post nasal drip, then that is just going to mean that it is that runniness that goes behind the nose and down the esophagus. Prefixes for your positions. So dextro is going to mean right. So right, like on the right side. So if you have dextrogastria, then that's going to be a displacement of the stomach to the right. So your stomach has actually shifted to the right a little bit. Sinistero, that's going to mean the left. So if someone is sinistromanual, then that means that they are left-handed. If they are dextromanual, they are right-handed. Endo is going to be within. So endoderm is going to be the inner layer of a developing embryo. Meso is going to mean middle. So mesencephalon, that's going to mean the middle portion of the brain. I don't know why this column kind of got cut off a little bit, so they're on different lines. But I'll make sure that all of the ones for the next coming weeks aren't like that. And then tele or tello is going to be end, far at a distance. So teletherapy is going to be radiation therapy that is delivered at a distance from the body. Okay, so our word roots. So now that we've talked a little bit about those prefixes, let's kind of touch on what a word root is. So your word root is going to be that basic meaning of the word. It's going to be that foundation of the word. You should not ever see a word root reported alone, unless we're talking about this is the word root for, and then whatever the definition is. You should always have either a prefix or a suffix to go with that word root. Typically, your word roots are going to describe your parts of the body that are involved. So stomach, gastro, bone, ortho, brain, encephalo, something along those lines. Our suffixes are going to be placed at the end of that word root. And then again, our prefixes are going to be placed at the beginning of the word root. Now, when a suffix or another root begins with a consonant, then, and that's going to be added to the root, then you have a vowel that's inserted between the root and then the next word part in order to aid in pronunciation. So that's what's known as your combining vowel. So those combining vowels are typically the letter O, as seen in the word gastroduodenoscopy. However, it can occasionally be an A, an E, or an I. A combining vowel is usually not used if the ending begins with a vowel, such as arthritis. If your suffix ends, or I'm sorry, if your suffix begins with a vowel, then you should not need that combining vowel to have a combining form. A suffix, that's going to be a word ending that modifies a root. That may indicate that the word is a noun or an adjective, and it often determines how the definition of the word will begin. When it comes at the end, again, it kind of gives that initial punch of your description or your definition. So if you have the word neuroplasty, that suffix plasty is just your surgical repair. So whenever you have a neuroplasty, it is the surgical repair of a nerve. Some of your examples that you have here, if they can either, like we said, they could either be a noun, so a person, place, or thing. So the is going to typically refer to a noun. Oh. Your pertaining to portion could be an act. So cardiac just means that it's pertaining to something. Osis, that's just going to signal that it's an abnormal condition or a disease. Your alga, itis, and megaly, these are going to indicate that they are an aspect of a disease, or it's going to be referring to that pathology of a certain area. And then your procedures are going to typically be represented by synthesis, graphy, scopy, something along those lines. You're going to have some suffixes that mean that it's a condition of something. So IA just means that there's the loss of something. So dementia is going to be the loss of that intellectual function. ISM is going to be like if you have racism, that's going to be discrimination that's based on a race. So it's that condition of. Cis is going to be, again, the condition of something. So thrombosis is the condition of having a blood clot in a vessel. And then your Y is just going to be, again, your condition of. So all four of those are going to be your condition of suffixes. You have some suffixes that are going to pertain to your medical specialties. So IAN, so if you have that, the one that you'll see on that the most is going to be a physician, pediatrician, no, it wouldn't fall under orthopedics. So basically they're just going to mean that they are a practitioner of whatever that field of study is that word root is going to fall under. Your iatrics, iatry, and ick, those are going to mean medical specialties. So pediatrics, psychiatry, and orthopedic. And then your ist, that is going to be a specialist in a field of study. So podiatrist, orthopedist, some things along those lines. And then your logy, L-O-G-Y, that's just going to mean study of. So physiology is going to be the study of function in a living organism. Pathology is going to be the study of diseases, because your patho is going to be your disease. Some suffixes that mean pertaining to, like, or resembling. So those you'll just kind of see, you can read through those here, your ick, your owl, your ack, airy, form, oid, orion, us. Now, the ones that are really fun are going to be your double R suffixes. Okay, these are not going to look standing alone. They're not going to look very easy to decipher. But your double R's can mean, pretty much a lot of things. So your RRHAGE or your RAJ or your RAJA, those are going to mean bleeding. So if you have a hemorrhage, then that's going to be the loss of a large amount of blood in a short time. So your hemo is going to mean blood. And then your RAJ or your ridge is going to be your abnormal or excessive fluid discharge. RAFI, that's going to mean surgical suturing. So if you have myorrhaphy, your myo is your word root for muscle. And then your RAFI is going to be the surgical suturing of that muscle. We've already looked at the diarrhea before, but dia just means through. And then your rhea is your flow or your discharge. And then rexus is a rupture. So if you have a myorexus, your myo means muscle, your rexus means rupture. You're going to have some contrasting and confusing prefixes. So again, we've already talked about the ab and the ad. So abduct versus adduct. They do have different meanings, but they do look similar. And then you have inter versus intra. So inter just means that it's between or among, whereas intra is within. So again, just make sure that you're paying attention to those letters at the end of those to make sure that you're interpreting those correctly. So when we have a pretty large word and we're trying to take those terms apart and we're trying to decipher what does this word mean, the first thing that we want to do is separate it into those respective word parts. So you'll start from your suffix and then you'll move towards the beginning and you'll identify each of those parts. So otorhinolaryngology, you have three word roots. Oto is one, rhino is another word root, Sorry, I don't know why my mouth keeps flipping things on me. And then layering is going to be another word root. And then your ology is the study of. So whenever we put those together, otorhinolaryngology, then that means it's the study of the ears, the nose, and the throat, also known as an ENT, because it's easier for patients to just say, I'm going to an ENT, than knowing what an otorhinolaryngology doctor is for. Okay, so now we have some pronunciation rules. So any vowel that appears alone at the end of a syllable, then it's going to get a long pronunciation. So the vowel is essentially going to say its own name. So an O, an A, an E, something along those lines. Any vowel that appears within a syllable, it's going to get a short pronunciation. E, like for an I. Those are going to be your short pronunciation. If you have a vowel that is at the end of a syllable, but it needs a short pronunciation, then we'll add an imaginary H on it. So vanilla. And then if you have a vowel with a syllable that needs a long pronunciation, then an imaginary E is going to be added, such as in that word repeat. And then the accented syllable in each word, whenever you see it broken down in your textbook, then it's going to be, your accented syllable is going to be accented with the capital letters. So if you look at the word accent, we know that that main syllable where we kind of put that punch in it is going to be in that uppercase capital letter. Commonly accepted pronunciation is going to appear in the parentheses next to the term in your textbook. You want to try to pronounce those new words if you can. There's still some words I still cannot say, and I butcher them because I'm from the South. So I will probably never be able to say certain words correctly. But if you want to try to not sound crazy while you're doing it, and your kids aren't going to come in and say, Mom, why are you talking to yourself? Then you can. But if you want to wait till the kids are at school or they're at bed or whatever it is, I'm always going to judge you. Some people will probably find it humorous if you try to pronounce the words in front of them. You could always make it a game night to see who can pronounce it correctly. So your primary emphasis, again, you're going to have those accented syllables, but you still want to look and see where your primary emphasis is, because you could have those in boldface. So you might have a accented syllable and a primary emphasis that are going to be the same, but they may be different in different parts. If you have your secondary emphasis, so again, your appendicitis, so it's not your full like primary syllabus, but syllable, not syllabus. I knew something was sounding weird about how I was saying that. Your syllable, not your syllabus. Sorry. That's why I paused for a second. I was like, wait, that did not sound right. And see, like I said, you'll hear me say things completely wrong all the time. Your secondary emphasis is going to be shown in a boldface, but it's going to be in lowercase letters. So now we're going to talk about some of those prefixes, or I'm sorry, some of those suffixes that are going to mean a plural or singular ending. So your word ending or your suffix can be your A, your N, your X, is, ma, your annex, your int, and your on, and so if we originally start them out with an A, so a vertebra, is a single vertebra, and then your vertebrae is going to be a plural. So if we're only talking about one, it's vertebra. Two or more is going to be your vertebrae. Your singular for an N is going to be for a lumen, but then if you have multiple, it's going to be lumina. Matrix, plural is going to be matrices. Diagnosis is not diagnoses, it's diagnoses. Stigma is singular, stigmata is plural. Your phalanx is going to be your fingers or your toes. So phalanx is going to be phalanges for multiple. Ganglion is going to be ganglia. That's a typo there. I'll have to fix that. It's going to be ganglia. Theorem is going to be singular, and then sera is plural. And then a single thrombus or multiple thrombi. So again, we have some lookalike, sound-alike terms and word parts. I know it seems like we're kind of beating a dead horse on this one, but many of our terms are going to look similar and sound similar, but they're going to have different meanings. So arterio means the artery itself. Athero is going to be that fatty substance that's found within an artery. And then arthro is going to mean joint. So they look very similar, the ATH and the R's, and they just look similar. So again, don't rush yourself through some of these terms because it can take you in a complete different direction than where you're supposed to be going with it. Your word part, as far as your suffixes, ectomy, ostomy, and otomy. Again, they're all surgical terms, but they do have different meanings. So ectomy is going to be a surgical removal of something. So if you have an appendectomy, you're going to be removing that appendix. An ostomy is going to be a creation of an artificial opening to the body surface. So if you have a colostomy, then you're going to be creating that artificial opening from that colon to the outside. And then otomy just means that it is just an incision or cutting into something. So a laparotomy, that is going to be cutting into the abdomen area. And then last thing that we'll talk about for med term until like we get into some of the bigger like the anatomy sections is this is just general intro to med term. Are our abbreviations. So your abbreviations can either be your acronyms or a true abbreviation. So your acronyms are going to be the first letter of each word in a phrase. So you have AIDS, which is going to be your acronym for acquired immunodeficiency syndrome. The CNS is going to be your central nervous system. Your appendix 2 of your textbook does have, it's not going to be an all-inclusive list of acronyms because we know that in abbreviations, because we know that there's billions of things out there. But those are just going to be the most common acronyms and abbreviations that you'll see. Symbols, those are going to be shorthand. So we always want to be really careful when we're using those because not everybody's shorthand is the same. Your L and your R with the circle, those are pretty, I don't want to say 100%, but those are pretty, some of the most common. Your arrows up and arrows down for increase and decrease, those are really, really tricky to use because some could mean an increase in blood pressure or it could mean a high blood pressure. So it really just depends. So they don't always mean upper or higher and lower or increase or decrease. They could mean, other things. But there are some of those typical symbols in Appendix 1 of your textbook. Okay. So now we're going to move on to our organ systems. So an organ is going to be a structure that's made up of two or more kinds of tissue, which is going to be organized to perform a more complex function than a single organ. An organ system, or I'm sorry, than a single cell. An organ system is going to be a group of organs that are kind of grouped together to perform a more complex function than just a single organ. So an organ is going to be your stomach. Your digestive system is going to consist of not only your stomach, but your esophagus and your intestines and all of the other accessory structures. So the integumentary system, that's going to include just one single organ, and it's going to be the skin. In most of your adults, your skin will weigh approximately 20 pounds, and that does account for an average of 16% of your total body weight. The integumentary is going to have millions and millions of appendages or structures that are going to be attached to a main part, as well as glands. So these are going to include your hair, your nails, your sweat, and your oil producing glands. Now, your skin is going to be very crucial to survival, and its primary function is going to be for protection. The skin will protect your underlying tissue against invasion by harmful bacteria, and it will bar the entry of most chemicals, and it minimizes the chance of mechanical injury to your underlying structures. Along with your protection, the skin will regulate your body temperature by sweating, as well as controlling your blood flow. The skeletal system is going to include not only bones, but also tissues that are related to your cartilage. You'll have 206 individually named bones, as well as some variable bones that will differ from person to person, and they will not have a specific name. The cartilage within the body can cushion bones that are going to be linked together and can be tasked as the connection between one bone and another. The skeleton will provide protection, and it will support framework for the brain as well as your other internal organs. So without your bones in their joints, then the body's not going to be able to move in the way that it does. Bones will also serve as a storage area for important minerals such as your calcium and your phosphorus. And the formation of blood cells in the red marrow of your certain bones is going to be another crucial function of your skeleton. And individual skeletal muscles, those are going to be organs of your muscular system. Muscles are going to be made up mostly of your muscle skeletal tissue. And it's also going to be known as voluntary muscles, meaning that it has the ability to contract when it is stimulated by conscious nerve regulation. When it is stimulated by a nerve impulse, then the muscles will shorten, which then cause the bones to move in articulation with others, and then those will cause our joint movement. While the primary function of the muscular system is going to be the movement of the body, it is also responsible for maintaining our stability of posture, and it will provide heat to maintain our body temperature. In addition to your skeletal muscles, the body will contain other muscles of different types that form the organs and other systems of the body. Both of these muscle tissues are going to be known as involuntary, and it's because they're going to be regulated by a subconscious mechanism. Your smooth muscle tissue, that's going to be found in the walls of your hollow organs, such as the stomach and your small intestines, and it helps move the fluids through the organs and often forms valves that will regulate when fluids may move from one section of a hollow organ to another. And then your cardiac muscle, that's going to be found within the walls of the heart. So by contracting, it's going to pump the blood flow through the circulatory system. And then some of our cardiac muscle cells in the heart will generate the rhythm of the heartbeat. The brain, spinal cord, and nerves, those are going to be organs of the nervous system. The extensive components of the nervous system will make it possible for our complex system to perform its primary function. Number one is going to be communication to and from our body organs. Number two is the integration of those body functions. It's also going to control the body functions themselves. And then it's lastly going to detect any sensory stimuli. The nervous system is going to be broken up into two smaller systems. So you'll have your central nervous system and the peripheral nervous system. The CNS will contain the brain and spinal cord, and the remainder of the nerves are going to be found in the PNS, which is your peripheral nervous system. Now, that PNS can recognize certain stimuli such as heat, light, sound, pressure, and temperature. The endocrine system, that's going to be composed of glands that secrete chemicals known as hormones into the bloodstream. The endocrine system will provide slower but longer lasting control by hormone secretion. So for example, secretion of the growth hormone control the rate of our development over long periods of gradual growth. In addition to controlling growth, our hormones are going to be the main regulations of our metabolism, reproduction, and our other bodily activities. Your cardiovascular system is going to consist of the heart as well as a closed system of vessels that are made up of arteries, veins, and capillaries. As the name implies, the blood contained in this system is going to be pumped by the heart around a closed circle of vessels as it passes through the body. It may also sometimes be referred to as the circulatory system. So the primary function of the cardiovascular system is transportation of oxygen and carbon dioxide, nutrients, hormones, and other important substances. It will also help to regulate body temperature by distributing heat throughout the body and by assisting in retaining or releasing heat from the body by regulating blood flow near the body surface. Some of the cells of the cardiovascular system will also function in defense of the body by way of immunity. Your lymphatic system, that's going to be composed of the lymphatic vessels together with other lymphatic organs that are made up of masses of defensive cells called lymphoid tissue. So instead of containing blood, the lymphatic vessels are going to be filled with lymph, which is a watery fluid that contains lymphocytes, proteins, as well as some fatty molecules, but there's not going to be any red blood cells. Lymph does not circulate through a closed circuit, but instead it flows through the lymphatic vessels, and it will eventually enter the cardiovascular system by passing through large ducts, which will then in turn connect with veins in the upper thoracic cavity. The functions of the lymphatic system will include the movement of fluids and small particles from the tissue spaces around the cells, and then the movement of lipids that are absorbed from the digestive tract back into the blood. All of the body's defense systems together, those are going to make up the immune system. So it protects us from disease-causing microorganisms, harmful toxins, transplanted tissue cells, and any of our own cells that have turned malignant or cancerous. The immune system also helps us react appropriately to various irritants and injuries. Our immune system is going to be composed of protective cells and various types of defensive protein molecules. Some cells have the ability to attack, engulf, and destroy our harmful bacteria. And then some of the others will secrete protein compounds called antibodies and complements. These will produce our chemical reactions that help protect the body from many harmful agents. The major organs of the respiratory system will include the nose, pharynx, larynx, trachea, bronchi, and the lungs. Together, these organs will facilitate the movement of air into the tiny, thin-walled sacs of the lungs called alveoli. And there, the air is going to be exchanged for the unneeded carbon dioxide. The organs of the respiratory system will perform a number of functions in addition to permitting movement of air into the alveoli. So for example, if you live in a cold or a drier environment, The incoming air can be warmed and humidified as it passes over the lining of that respiratory air passageway. Your inhaled irritants, such as your pollen or dust, can be trapped in the sticky mucus that covers the lining of the passageways, and then it's going to be eliminated from the body. The organs of the digestive system are often separated into two groups, the primary organs and the secondary organs. They work together to ensure proper digestion and absorption of nutrients, as well as the elimination of waste. The primary organs will form your digestive tract, also known as the mouth, the pharynx, the esophagus, the stomach, the small intestine, large intestine, the rectum, and then the anal canal. The secondary organs may attach to the digestive tract, or it could possibly be inside or a portion of it. And those are going to be known as the teeth, the salivary glands, the tongue, the liver, the gallbladder, pancreas, and your appendix. Your urinary system, that's going to include kidneys, ureters, urinary bladder, and the urethra. The kidneys will filter out the blood of waste products that are continually produced by the metabolism of nutrients in the body cells. They'll also play an important part in maintaining our electrolytes, water and acid-base balances in the body. And then the waste product that is produced by the kidneys, that's known as urine. After the urine is produced, it'll flow out of the kidneys through the ureters and into the urinary bladder, where it will be stored temporarily. After that, it will pass from the bladder to the outside of the body through the urethra. And then lastly, our reproductive systems. So we're going to have two different reproductive systems for the male and the female reproductive system. The male reproductive system includes the testes, which produce the sex cells, the sperm, and the hormone testosterone. A tube called the vas deferens is going to extend from each testicle, and it will lead to the urethra. Surrounding the urethra is known as the prostate, and externally the male has the penis and the scrotum, also together known as the genitalia. The urethra will pass through the penis and it will carry sperm to the exterior and act as a passageway for the elimination of urine. For the female reproductive system, this will include the ovaries, uterus, uterine tubes, also known as the fallopian tubes, and your vagina. Eggs are going to be produced by the ovaries and then travel through the uterine tubes where they can be fertilized by sperm. Once it's fertilized, it will move down to the uterus where it will then implant and form a connection with the mother's blood vessels. After about 9.5 months, the fetus is then delivered through the cervix of the uterus and then through the vaginal canal.